Good afternoon, everyone. I'm Jane Barrow, Associate Dean at HSDM, and thank you for joining us at today's Global and Community Health Seminar Series, Oral Health and Sustainability, Crimson Goes Green at Harvard School of Dental Medicine. So we've been hearing a lot about climate change and the environment. We hear about trash in the oceans. Unfortunately, a good chunk of it related to oral health. We hear about toothbrushes, packaging, dental floss. We saw back in 2019 a massive student protests, young people getting out under the direction of Greta Thunberg. And recently at the end of 2020, there was a Lancet Global Climate Change and Health report that came out indicating that changes in the climate and the environment were having significant impacts on health. All of this can feel somewhat overwhelming for us as individuals, and we might want to know, how can we have an impact on all of this? Can one individual actually make a difference when these issues seem so enormous and far-reaching? And I'm really pleased to be able to present this panel today. We've got a dynamic group that spends quite a bit of time thinking about these issues and how we as individuals and as a community at HSDM can begin to make a difference and lead by our example. We have a sustainability committee at HSDM whose mission is to empower HSDM to institutionalize sustainability practices and foster a community that values and pursues sustainable efforts to work toward a better future for our patients, our profession, and our world. So I'm very pleased today to be able to introduce to you our panelists. I will begin with Carrie Sylven, who has served as Director of Student Affairs at HSDM since 2015. Prior to that, she was Associate Director of Student Affairs at Tufts School of Dental Medicine. She earned her bachelor's degree from Bates College and majored in environmental studies, so very apropos to have her on this committee. She also holds a master's in education from Boston University with a concentration in higher education administration. She is passionate about supporting students and helping them meet their goals. Lia Sgourakes is Associate Director of Facilities and Operations in HSDM's Office of Administration and Finance. She began her career at Harvard in 1984 and has been part of the HSDM community since 1993, beginning as Special Assistant to the Dean under Dr. Donna. Lia received her AB from Smith College in Studio Art. HSDM has been home for 28 years, and she treats it as such and builds a culture where we all care about our school and surroundings. Everything is always in excellent shape under Lia's direction. Jennifer Lee is a fourth-year dental student at HSDM. Her research background spans preclinical dental education and the integration of environmental sustainability into dental curricula. Jen has led the development of HSDM's Green Team and Sustainability Committee, which focuses on community education, waste reduction, waste diversion, and she has conducted a preliminary waste audit for us, which I hope we'll be hearing a little bit about in a few minutes. Jen is dedicated to integrating environmentally sustainable practices into the dental profession and cultivating a community that supports the well-being of everyone, including the well-being of our planet. And finally, Dr. Donna Hackley is a pediatric dentist and instructor at Harvard School of Dental Medicine. She led the HSDM team that developed teaching capacity and infrastructure for the Pioneer School of Dentistry at the University of Rwanda and served as co-PI for the country's first national oral health survey. She participated in curriculum reform at the University of Medicine and Pharmacy School of Dentistry at Ho Chi Minh City, Vietnam, and led a team developing school-based oral health services in Everett, Massachusetts. She's also the faculty leader of our Sustainability Committee, Green Team, and Donna strives to promote contextually relevant, sustainable, and inclusive development and leverage her practical experiences to inform operations and policy as we move ahead with our efforts. So welcome all of you. And Donna, would like to start us off?
Great. Thank you so much, Dean Barrow, and thank you to the panelists. We as a group are so excited to be here today. And thank you for all of you for joining us. Let me share my screen and we'll get started. I hope you enjoy the panel discussion today. Great, get organized. Okay. So moving right along. We have basically 3 objectives today. We hope that we highlight or suggest the relationship between oral health and environmental health. We want to describe some of the opportunities here at HSDM to be agents of change. And I hope that you find that we present many different ways by which you can take part, be involved, from individual efforts that you make all the way to research projects or projects within the school that aim to reduce our carbon footprint. And then we also wanted to give more information about the sustainability team. I think when you're not in the know, you might think of sustainability just as, oh, they're the people that put out the recycling bins. Well, yeah, that's one thing that the sustainability committee does, but it's so much deeper, it's so much more diverse, and we have really an amazing interdisciplinary team, and I'm excited for you to learn more about that today. Dean Barrow mentioned the Lancet policy brief that was just produced now in December 2020, and it specifically talks about climate change and environmental health and impacts on general health. And that you can see this, it's a 3-page policy brief. It also links you to the greater policy. And basically you can see we have environmental impacts, which are being researched and documented today on mental conditions, ADHD, hyperactivity disorder, autism, respiratory conditions, here type 2 diabetes. And you can see that many of the medical conditions or health conditions that are listed have clear links to oral health and to our profession. Also on the cartoon picture, you can see means by which we're contaminating the environment, we meaning humanity. So that's anthropogenic materials that's ending up in the environment that we actually have the power to reduce or eliminate. The big factors are wildfires, transportation, power plants, and agriculture. So there's so many ways where we as individuals and we as oral health professionals and we as people working in an institutional system as big as the Harvard system, we have ways that we can make a difference. This was in the New York Times yesterday. So it's not only that the Lancet and researchers are beginning to document not only climate change itself, which is now basically accepted, but also the health impacts of climate change. And this just ran yesterday, and the authors commented on effects of heat, air quality, you can see food and water, infectious borne diseases, and vulnerable populations. And these aren't far away concepts, remote from Boston. Heat stress can affect our communities right in the Boston area. And if a patient is sitting in your chair and they're coming from a home that doesn't have air conditioning, and we're having a heat stress, and they're in a neighborhood that lacks trees and is a industrial feeling neighborhood, they may have kidney effects, or some of their medications might not be working as well as they should because of that heat stress. Then that can very directly impact how well our appointment goes with them when we're providing dental care. Air quality, of course, is linking to us, right? Our patients are going to come with asthma or chronic pulmonary diseases. And how does that link to oral health? Well, there are already studies that show asthma and caries are related. So is it possible that with changing air quality, we may see a change in asthma rates, and then we may see changes of patterns of caries? Food and water. So, we can have the contamination of those which can bring us to malnutrition and a variety of presentations of malnutrition. Infectious-borne illnesses, immediately, especially being in global health, we think of malaria and things like that we don't deal with in Boston, but there's Lyme disease, there's Rocky Mountain spotted fever disease, and those have a chance of increasing, and they also have oral presentations to those diseases. And with regard to the diseases that we haven't seen yet in Boston or in the US, there's a chance that with shifting climate, we're going to see those vectors carrying those diseases to new places. And of course, all of this with climate and health relates to vulnerable populations, whether it be socioeconomically disadvantaged people, elderly, children, pregnant women, those with chronic illnesses or disabilities. Vulnerable populations are even at higher risk of climate change. So, and by the way, another thing that's just been in the news is GM, you probably saw, going to zero emission cars by, I forget the year, 2050, something like that. But they've come out and made a statement that that's what they're working toward. We have at Harvard the Harvard Global Health Institute, and there's a lot going on there. And I don't know if you're even aware that we have this. They specifically have a section on climate change and health. And if you link into that, you can link to some of the studies that are being done and find the evidence base for reporting out these health changes that are linked to climate. They also have a course, which is Harvard edX course here on the right, called The Health Effects of Climate Change. So it may be something that if this is interesting to you, you can take that course and begin your personal growth in this area. Now, basically, they don't use this exact diagram anymore. This was about 2 years ago, but the New England Journal of Medicine has a series of articles, and many of the authors are Harvard faculty associated with the Global Health Institute I just showed you. And what this diagram is showing as an overview is there are 4 main factors here that we're concerned about when we think about environment and climate. CO2 emissions here, increased heat, adverse weather events, and rising sea levels. And through those factors, we have different pathways that can affect our health. Heat stress here, poor air quality, food and water degradation or contamination. Well, actually, this is food, not having enough food, and water contamination, adverse weather effects. This is social factors, which can relate to forced migration and the many angles that go with that, and vector-borne illnesses. So it's through these pathways, with these factors acting, that health is affected. And if you go to the New England Journal of Medicine website, you can click on the various bubbles, they'll open up, it will describe more for you, and also link you to current research and projects that are going on. So we know oral health and general health are related. If you are interested to learn more about why are we in so many ways is oral health, the mouth, not considered part of the body? There's a great book by Mary Otto called Teeth, and it's really an interesting read on social determinants of health and how dentistry and medicine became separated and why we need to come back together, which is certainly a big push at Harvard School of Dental Medicine, where Dean Barrow is also on a committee for that, to reintegrate oral health and medicine. So there are various organ systems that are linked between oral health and general health, as you know, and as you're learning. So inevitably, if climate is affecting health, by nature, it's going to be affecting oral health. And I hope that we look for ways to research that and also impact that favorably. Now, basically, we have a bidirectional relationship between health and environmental health. So we know that some of the things that we do as humans, as dentists, as oral health professionals, being in our institution, training and service delivery and our private practices, we affect the environment. And by the flip side, which is maybe not as easy to see, the environment and the health of the environment is going to impact health and oral health. So for example, I'll just do a couple brief examples and turn it over to Jen, who will speak next. NOMA is a condition of malnutrition and poverty. And, we can contemplate if malnutrition increases as a result of climate, will we then also see an increase in the rate of NOMA, which is, it's a gangrenous disease. Now it starts as gingivitis or periodontitis. So, two things. Can we track the amount of NOMA? Is it changing in relation to climate? And is there a way to train people to spot it early before it's reach this point of disfiguration? And it often results in death, actually, 80% of the time. So, this could be an avenue by which we can study the link between environment and oral health. Orofacial trauma could be another area that we might see connections to climate. There will be inevitably fights over land and water rights. Heat stress is going to bring mental health and stress, and that can be shown by trauma and forced migration. With forced migration, we also have a higher chance of violence. And when we have those chances of violence, many times it's in the orofacial region. So that could be an area for us to study deeper. How about related to poor air quality? I mentioned caries rates and asthma. Will the oral microbiome be affected by changing air quality? Asthma is related to, and poor air quality possibly related to dental growth and development. And again, will we see other stress-related oral manifestations? Autoimmune diseases, aphthous ulcers, that sort of thing. So, there are plenty of ways for us to begin to research and build the body of evidence to identify how climate change or environmental health is affecting oral health. Now, if you're thinking about a research project and you are thinking in the oral health realm, it could be any of these listed here. And the one that I haven't yet talked about is practice preparedness. And that's something that we definitely see even now with COVID-19. So for all of the serious hardship and loss of life and suffering that COVID has brought to us, we are definitely learning some things. And one is that our practices weren't ready. Suddenly we were shut down, sometimes for weeks on end. What happened to our faculty? To our staff? What happened to our patients? How do we communicate? How are we financially managing for our personal selves and for our practice, which then impacts our employees and their families? Did we have enough PPE? Were our systems in place? There's so many things to think about practice preparedness and researching what would be the best practice to be ready for a shutdown like COVID or a flood, maybe when we lose our electronic records or we lose our actual physical office space. These are all possibilities that we can be developing best practices for. And with regard to environmental health, we can be researching within our home institution, reuse of materials, the waste management, and some of these things, I'm excited to say, the Sustainability Committee and the other team members that you're going to hear from today, many of these things are already underway. So it's an exciting place to be. I hope that you're finding some interesting content and might decide to come on board with the Sustainability Committee and its projects. So, where do we see ourselves? Are we, how can we begin to sort of divide and conquer the various factors involved here? Power plants, okay, how much power are we creating or using in the school, in our homes? Travel, how do we get from here to there? Are we biking, walking, or driving? What can we do? Agriculture, are we eating a lot of meat, and how is that impacting the environment? All of these things, we can look at ourselves individually, and we can look at our HSDM community. So thank you for listening, and I'll turn it over now to Jen Lee. Thank you.
Thank you, Dr. Hackley, for establishing that relationship between oral health, and overall health, and environmental health. Hi, everyone. My name is Jen, and I wanted to say that my interest in sustainability peaked when I was seeing all the waste produced in the world and beyond that in the dental clinic. And since then, I have expanded on what I like to learn about in terms of procurement for materials, so also waste reduction and everything that Donna talked about. And so we'll go ahead and start with what is currently in the dental literature. And just to say that human health can't be understood or protected from separate from the health of our ecosystems, because we depend on them. We depend on food sources and stuff like this. So integration of biomedical thinking and environmental thinking is needed. So when we look at the literature, there's a lot of things revolving around environmental sustainability, but unfortunately not a lot of content, including dentistry. So here you'll see some research from the NHS, which is based in England, and it's their dental health system. And on this graph, you'll see blue and red, and that's the biggest carbon footprint that dentistry is producing over there would be transportation. So both patient coming to work and the staff. And then once we take travel out of the equation, you'll see that procurement of materials, so lab fees, materials, and administrative expenses. So all of these things we also have. Unfortunately, we don't have data quite yet, but that is something we're working on. So there are barriers to having environmental sustainability practices put in place on the infrastructure level, having policies and laws in place to encourage people to monitor and track these things at institutional levels, having backing and support to help implement these things. At the educational level, having the ability to have the knowledge and capability to make these informed decisions on things that you are doing as an individual and as an institution are doing for carbon footprint and environmental sustainability. So dentistry is starting to go green. So you'll see here some corporations, and the ADA even has a page on their channel, so you can check out their website, and they have 80 ways to make your practice go green. And it go anything from turning off the lights at night to reducing supplies by going digital. So there's 80 tips on that website. There's eco dentistry, which promotes the use of products that are made in a sustainable way, so they have more eco-friendly product life cycles. And then Practice Green Health is a more general healthcare company for environmental sustainability practicing. Now I'll move on to our green team. So our green team has an interdisciplinary approach, and you'll see here that all of us work together on one committee. So in establishing our committee, we wanted to have key stakeholders from all of HSDM. I'm proud to say there are a few members with me today, so I'm so glad that we could present to you today. And we basically started, me and a few students, Nikki and Lilia, after hearing Dr. Hackley present on her sustainability work. And we figured that we weren't the only people interested in helping decrease carbon footprint and increase environmental sustainability at HSDM. So we asked key team members around the school to help join us. And so Carrie's here today, and I'll let her talk a little bit later about what she does, and also Lia. And we also have our infection control through the campus environmental and safety and services. So we'll touch on all of those. And the strength of our team lies in the fact that we are interdisciplinary, and we are able to help each other in areas when I may not know something, and or the struggles of the logistics behind putting a recycling bin somewhere. Lia comes in and helps with that. So it's very vital that we have this interdisciplinary approach to sustainability, because without everyone on this team, we wouldn't have the knowledge in order to make change. So speaking of some changes, our first initiative happened right before we departed in March. So we celebrated Earth Day with an Earth Day tea time. Maybe some of you were in attendance, but we encouraged everyone to bring a mug in order to reduce the cup waste. So tea time is a very valued event at HSDM. And so we held a special tea time after tracking cups for the month of January. So you'll see here the waste produced in the bottom right graph. And during this time, we encouraged people to bring their own mug to tea time, and then also gave out reusable mugs. And our green team was here to help show. Unfortunately, this is something we cannot do right now, as green tea time is on hold, and also it's probably not good for the infection control. So this just reminds us that moving forward, we have to have the infection control mind in as we make these initiatives and promote change. On our next slide, these are some of the other things that our green team discusses at our meetings and has started to implement. We did our first preliminary waste audit, which I'll show next, but we are in works to get both a school-wide waste audit with the help of Harvard University. I should say that Harvard University had a beautiful sustainability 2020 plan, and they're working on another one. And Harvard has a well-established, that Donna talked on, sustainability promotion and encouragement for research. And so we have a lot of support from Harvard University in our work on this team. And we also have the opportunity to work for an energy audit, so we can see the baseline that we're working with. So as we implement changes, we can track them and do the research. We are implementing composting and recycling. I'll probably let Lia touch on that. We've discussed fume hoods and having trackers and sensors in our research labs to help the fume hoods reduce leakage of fumes and other things when they're not in use. We have reduction initiatives. So on this flyer here, you'll see bring a lunch. So when you bring your lunch, you're decreasing on all the products that are used at the cafeteria, or for instance, you are bringing a lunchbox that is reusable in Tupperware that's reusable. So just small things as an individual that you can choose to do every day by using reusable plastics and not having the one-time off use. We're also working on our sustainable masks. So Carrie is leading this one with one of our other students, and just having information for people on how to, in a infection control proper way, maybe on the weekends when you're out and about, making sure you have a reusable mask, and also ways to make them hygienic and clean them. And lastly, transportation. As it starts to get warmer in the year, we will encourage people to commute by foot or by bike to the school in order to reduce their individual carbon footprint and thereby reducing the school's carbon footprint. So all of these things are things that we talk about. And if you have input or would like to be involved, please reach out. Now I can show our first event. When we kicked off the Sustainability Committee, we had a preliminary waste audit. This was back in October of 2019. And you'll see me and two classmates here. And we geared up, got our PPE on, and we separated the trash. In the top right there, you'll see after we took a very intense exam where we made a bridge from 3 to 5. And we went through and separated everything out. So you can see we have masks, we have boxes from our gloves, we have gloves, paper towel, sheets of paper that we keep our desk cleans with, brushes, gowns. So all of this material here, and this is our baseline. So as we move forward, we now have this to track and see where we think we can make changes. So this is one of the beginning steps of our team, and I'll turn it over to, I think Lia is next.
Hi. So as everyone on our team, I'm personally care very much about my environment, and especially for preserving it for those to come after us, and to try it to the best of my ability to help that along. I'm personally a fiend about waste and recycling, and I'm often seen fishing things out of the trash and washing them out to put them in the recycle bin. I know that's a small thing, but everybody needs to do just that, those little parts to change our culture too. At the school, my responsibilities are for overall the preserving of the physical plant. And ways I've helped and can help is to implement school-wide initiatives. We've done a bit already. We've gone to heat and light occupancy sensors so that we're saving energy there. We're doing single stream recycling, but we now would like to also do composting and have a more concerted effort to push the culture of recycling. In our teaching practices, we've gone to touchless solar powered faucets to save water. In our research labs, we've been swapping out the -80 refrigerators for more energy efficient models. And with any renovation we do, we keep at the forefront. The university has set certain, they have approved green products, and we try our best to use those products in our renovations. And I already talked about composting. And the dental center is another area that we can, we have representation. They aren't here today with us, Susan Cottrell and Andy Radix, but they are helping us in our research for alternative PPEs and dental materials, or companies that are more sustainability minded. Carrie?
Sure. Thanks, Leah. Yes, I, as Dean Barrow said, I do have a background in my undergraduate career in environmental studies. And so it's sort of been a passion of mine to, you know, continue to look for ways that I can do my part to sort of streamline and improve the processes that we have in place. And just because we do have an obligation to ensure that future generations have access to the resources that we have and the environment that we have today. So I came naturally to this committee, one, because I really enjoy supporting students and student ideas and initiatives. And two, because I'm sort of passionate about sustainability as well. And I think it was Donna who had mentioned that, or maybe it was Jen, about the reason that we can be so successful in our group here is because we are so interdisciplinary. I came from a much larger organization or institution before starting here at the dental school. And it was a much larger task to get the right people into the room to have these kinds of discussions and to make informed decisions about attainable goals and objectives, because we just had sort of a vacuum of knowledge of how everything fit together. But here at the dental school, being a part of a small dental school, you really have a much broader understanding and can easily get the people into the room who need to be in the room to make decisions and figure out what's attainable and how we're going to overcome some of the barriers to achieve our goals in promoting more sustainable activities. And sometimes I feel like my role is to manage expectations, and sometimes I'm a little, I feel like I end up being more negative because I'm like, well, I like your idea, but that's not going to work because of X, Y, and Z. So I think Leah and I really tried to be as realistic as possible and figure out how do we shift this so that it is attainable, and how do we get the right people in the room in joining the discussions to partner with us so that we can work towards this and achieving some of these goals that we have. And, you know, one of the other kind of objectives that I have is just to sort of draw on my network of student affairs professionals around the university to find out sort of what their schools are doing in terms of sustainability, draw on the expertise of others within the university, and pull those people into our network here. We unfortunately lost one of our key staff members who was involved at the university in the university sustainability office, and we're sort of right now kind of trying to find who's our connection at the university sustainability office that's going to help guide us and lend some of their expertise. So it's kind of just building our network and drawing on the expertise that we have available to us at Harvard University. Yeah, I really enjoy supporting the students and everybody that's involved in this committee.
Well, thank you all for some initial thoughts on the activities we have underway and helping us understand your passion around this issue. Carrie, just following up on some of your comments, I'm just curious in terms of your experience at Tufts and in reaching out to other parts of our university. Do you feel that the HSDM students are particularly passionate about this? Do you feel like we're making greater strides perhaps than other schools? Is it easier, more difficult from our vantage point as a dental school to engage in some of these activities?
Yeah, Jane, I definitely think that, you know, I'm always so impressed by the work ethic and the determination of our students. Jen, you know, has just been so instrumental in prodding along our group and making sure that we're holding ourselves accountable. And, you know, I think one of the challenges from my experience working around sustainability at my previous institution at Tufts Dental School was, I think one of our biggest barriers and what we could hardly ever get past is just the infection control barrier of reducing waste. And that was, we really didn't broaden our horizons beyond that and try to look beyond that, because there was just, we kind of hit a wall, and we just didn't have the access to the knowledge base and the expertise of different people representing, facilities and representing different aspects of the school, the way we do at HSDM, where we have a much smaller community that, you don't have to reach that far to get that expertise, because so many of us wear so many different hats and are able to sort of come together and strategize and lend their expertise and share more information about the systems that we have in place and what's feasible, what's not. Here's why it's not. And that helps to sometimes, understanding why we can't do something helps to improve our knowledge of systems and work sort of longer term for how those things can be improved.
I'd be happy to take some questions from the audience if you would like to send some questions into the chat. But Carrie, I think I'm hearing that we have sort of a two-pronged path forward. As an academic institution, we have challenges that all other parts of the institution might have in terms of thinking about how we deliver our educational programming, but also being the only organization within the university that offers clinical services. We have that extra layer of complexity in terms of thinking about infection control and all of the additional waste that might be related to that. So we have to work maybe twice as hard to think about how we can be green and engage in sustainable activities. And to that point, Lia, I'm just wondering if there's any low-hanging fruit. Are there potentially ideas on the table right now that are being discussed that with a little extra nudge we might be able to put into place?
Sure. We've installed aerators in the main building to control the water supply, but we haven't done that in the research building. So that's a small thing that we can move forward. I'd like to go to flushometers in the main building that are battery powered, so that we're not wasting as much water in those toilets. And I do have 2 air handlers in the old building that need to be replaced, and I'm assuming that newer models would be much more efficient. So they're on the docket as capital plans for the next few years. So those and water bubblers that maybe are a little more efficient as well. That's another project I have in mind.
Excellent. Jennifer, I'm curious if our group has been in contact with students at other dental schools and what sorts of ideas might be in the works elsewhere.
Great question. So when I did my research project that Harvard allows and promotes us to do during school, I was over in England working with Queen Mary University, and we did our research paper there, and they also are very interested in sustainability, and that's where I had the experience with the NHS and working with them. And so they at their school have bike racks out front, and they promote everyone to bike in. So that's something that they have been doing. We've also been in contact with students at UCSF, and they just started their Green Teeth Club, and Dr. Hackley and I actually presented to them earlier this week, and they are doing their first waste audit tomorrow. So we've been an inspiration for them, and it's been nice working with them because they have new ideas coming for us too. And then also University of Michigan, they were how I initially figured that dentistry can be sustainable. They had a glove recycling program, and that was one of the initial things we had thought to do here, because they have an established program where they recycle all of their gloves from their clinic. And Adam, who used to be the environmentalist on our team, helped explain that the way that Harvard has their trash taken away in the facility that we use, it's actually more efficient to go with this route than have the reuse and reduce. So it was great for me to have this idea, but also see that Harvard's already doing what it can to have sustainable waste systems. So even though it's working at University of Michigan, it may not be what we need here. So it's nice to have that collaborative and interplay between schools, because we may have strengths that they are still working towards. Thanks for the question.
Yeah, that's great. And it also sounds like there are options, that there's not a necessarily one size fits all answer to how we go about trying to become a sustainable organization. So that's great to hear. Donna, you mentioned that there are new products that are available. Bamboo toothbrushes, maybe. Could you tell us a little bit about some of these newer products that are being brought to market that might help us be more green in our daily activities?
Yes, thank you. So that centers on the idea of plastics. And I tell you that I think in dentistry, we have so many ways to look at where we use single-use plastics and toothbrushes, which are not single-use, which are certainly disposable. They are only about 9% of plastic gets recycled. The rest is either incinerated or goes into landfills. So, you know, there's plastic trash floating in the ocean, and you can find thousands, hundreds of thousands of toothbrushes in there. The problem with plastic is it can break down smaller and smaller and smaller to microplastic or even nanoplastic, but it never goes away. So, you know, that you can say, oh, I have biodegradable plastics, but they're never really gone. So why do I care about that? Well, those nanoplastics and microplastics are made with plasticizers that are known carcinogens, and they also absorb carcinogens from the environment. And plankton or smallest shellfish, those that live in the sediment in oceans, eat them because they have a smell or a look that's appealing, and they not only fill up and feel full and then starve to death, but they, if they survive, they're eaten by bigger fish and so on. And so that microplastics and nanoplastics bioaccumulate up the food chain, and eventually make their make their way to us. Toothbrushes in particular are not recyclable because they're made with a plastic handle, nylon bristles, and then tiny brass staples that staple every tuft of bristles into the handle. And because of those little tacks, they can't be recycled. So, but we can do away completely with the plastic toothbrush and switch to bamboo. So that's obviously biodegradable, a natural source, easy to replenish, grows quickly. And in my vision, especially in global and community health, I would love to see countries not import toothbrushes anymore. And you know, the developing countries that have the climate to grow bamboo could actually create their own bamboo toothbrush and boost the socioeconomics of the community as well as improve the environmental health of the community. So there's also a possibility of toothpaste tablets rather than the paste that we buy in tubes, because every tube is plastic and it's packaged in cardboard that might be wrapped again in plastic. So you can buy a container of toothpaste tablets and you chew them up until they make a foam and brush and rinse. So I have them and I pass them out to my family at Christmas time and got feedback. And what everyone said was they liked it. They didn't mind the chewing to make a foam, but then they felt like it was a candy mint that they wanted to swallow. They had to remember not to swallow it. But so it's possible. There's also floss that's made to be biodegradable. So there are things we can do personally. You can look in the office too, by the way. We can look at plastic suction tips and saliva ejectors and single-use brushes, all of this stuff that we use once and throw away. And then I hope we find a way, both as all of the other panelists have said, about waste reduction. You know, when I look, some practices are covering the entire operatory in plastic because we're in COVID-19. And you know what, there's just got to be a different way, you know. So I hope we look further into that. So, but thank you for the question.
And one thing I just wanted to piggyback on that, Donna, is that two other members of our committee who aren't able to be here today are Susan Cottrell, who oversees infection control, and Andy Radix, who oversees materials management. And having them as part of our discussion is just so vital to learning more about, who we source our materials from, how, the different aspects. It's very educational for us, and it really helps us to have them at the table, but also for them to be hearing what our goals and objectives are, so that they can make more informed decisions in the limited ways that they can when we do kind of pursue contracts and consider different materials and infection control methods.
Jennifer, I'm wondering if you could tell us if we wanted to be involved either in the committee or start dipping a toe in sustainability efforts. What do you think, what would your recommendations be in terms of the 1 or 2 things that individuals could start to do to begin their journey on being a more responsible citizen of the world?
Great question. And I think it's also very hard when you think about making change and you're like, this is something so big. So what I would recommend is doing a personal waste audit and just like tracking what you do during the day. So I did this for myself earlier this week because I wanted to practice what I'm preaching. And I read about how leaving the water on while you're brushing your teeth can release up to 90 cups of water. And I was proud that I don't keep the faucet on, but during even just the last 20 seconds, I do. And I was shocked because I thought I was doing it right because 2 minutes is off, but the last 20 seconds is on. So just doing a personal waste audit and seeing what you do. I've started using, instead of a dinner plate, I'm using my Tupperware, and then I just put the lid on at the end. So I'm just trying to reduce in general how I practice my own usage. And so just having that preliminary personal waste audit and seeing what you're throwing away, how much water you're using, how long do you have the shower running before you get in it? I know some things, maybe it doesn't heat up as much, but there's always reasons why not to, but try to find the reasons why to. And I think second is information. So when we started this, I would like to say I was no background in environmental sustainability besides the interest and the motivation to make change. So I think just reading and getting involved, and Dr. Hackley, the article she posted today that was read 2 days ago, just having notifications turned on for something that's environmentally related and just reading up on it and how you can read it and then also apply that in your life. And then also, if you would like to become involved, you can go ahead and email me, and you're more than welcome to come to a sustainability meeting. And we would love to hear any comments that you have.
Excellent, thank you. I think that was a very thought-provoking response. I wonder if many of us in the audience have really thought about some of those things, like leaving the water on while we're brushing our teeth. That's a really excellent example of a habit that we could easily change that would begin to make a difference. And I do think we're seeing a lot about climate change and health in the press. In fact, in today's Harvard Gazette, there's an article which features many of our collaborators in it that discusses the impact of the environmental changes with smoke and climate and water and vector-borne disease. And I also want to give a shout out to Dr. Hackley, who did have a commentary published in the Journal of Dental Research back in October discussing oral health and climate change. So I encourage all of you to check that out as well. So I'll just ask if anyone has a final comment to make before we conclude today.
I'd like to say one thing. We do have a number of students who are members of the Sustainability Committee as well. And Jen is our representative today for the panel. But some of the students are working on general sustainability initiatives within the committee. And some are part of the committee because they have a targeted idea of a project they want to spearhead. So it's possible for those of you thinking about projects that you can do it either way. It's very flexible. We're open, we're welcoming. We hope you join, and we'll support you to follow up on your interests.
Thank you, Dr. Hackley. Lia, Carrie, Jen, Donna, I thought this was a great panel today. I learned a lot. I hope that our audience did as well. And we look forward to more excellent suggestions and incremental changes to make a difference at HSDM. Go green. Thanks, everyone. Bye-bye.
Thank you.
Thank you.